So let's give you another tool that is really, really helpful. And as you'll see, each one of those tools works a little bit different. So the next herbal compound that we are going to be looking into is ginger. Ginger is a spice, right? And it comes from the rhizoma of the plant gingerbeer, and it's native to different parts of Asia. And it has been used in traditional Chinese medicine and Ayurvedic for centuries. Some of the use of ginger is really dating back to the 15th century. And it's really known for its strong anti-inflammatory, antioxidant, and antimicrobial properties. So let's take a look at a really interesting picture of some of the mechanisms from ginger from the Journal of Nutrients. This was published just recently in 2024. So as you can see here, and this is more specifically focused on joint pain, ginger has several mechanisms. It reduces the inflammatory cytokines such as tumor necrosis factor alpha. It also reduces the inflammatory enzyme COX-1 and COX-2. It's also reported to reduce oxidative stress, which is really important because every time you have inflammation, you also get an increase in oxidative stress. And oxidative stress can damage our cells, can cause ongoing damage to our cells. If the inflammation is in the joint, it can cause ongoing damage to our joint. If the inflammation is in our nerves or muscles, it can cause damage to our nerves and our muscles. So when we look at ginger, the dosages, like with other compounds, is really, really important. And we always recommend our community members of healthcare practitioners to use the effective dosage that was found in human clinical trials, because that's how we know the safety profile and that's how we know the effective range for those supplements. There was an interesting study with patients with rheumatoid arthritis, and they essentially provided them with 1,500 milligrams daily of ginger for 12 weeks. And they found a significant reduction in disease activity score and reduction in inflammatory cytokine. The dose is going to be typically ranging between 500 to 1,500 milligram daily. That's typically the consideration for dosing for patients with chronic pain. If you're combining curcumin with ginger, then we can go at a lower amount of ginger. You can go with 200 to 500 milligrams per day. You're getting some of these synergetic effect, right? With blocking, for example, inhibiting COX-2 and some of the inflammatory cytokines, and both are anti-inflammatory and antioxidants, right? So far we talked about two herbal approaches to reducing inflammation. And the next one that Dr. Chill is going to go into is a different type of supplement, which is not a herbal supplement. And the reason why we wanted to include this third type of supplement is because with some patients, if they are on polypharmacy, right, and they're taking so many different medications, and we want to make sure that we're avoiding interaction with medications, then sometimes going with a nutritional supplement is going to be safer than going with a herbal supplement. And again, our focus really is how can we reduce pain through reducing inflammation, right? And that's why I'm wearing my red shirt today, to remind you that we're talking about inflammation. And inflammation, unfortunately, is a major cause for so many chronic diseases beyond pain.
And this is kind of like the art form of being a practitioner, is you actually have to understand what the patient is going through, their past medical history, their current medical history, their supplementation that they're currently on, their medications that they're on, and whether you can do a combination of these supplements for the patients. And you want to look at the severity of their pain. Do you want to add in a couple more? So this is kind of where you'll need to utilize some of the art part to being a functional medicine practitioner. Now, with that stated, we wanted to provide you with another alternative. This is more of a nutrition type of alternative for NSAIDs. And before I go into that, we want to do another pop quiz for you guys. So the question is, how do we reduce the systemic inflammation and oxidative stress? Is it 1, reducing sugar and processed food, 2, increasing vegetables and fruits, 3, increasing consumption of omega-3s. 4, finding the root cause that drives inflammation. 5, eat more meat and chicken to get more protein. Number 6, all of the above. Or number 7, all of the above outside or besides number 5. And now the correct answer, if you answered number 7, all of the above besides number 5, that is the correct answer. Why is number 5 incorrect? Because if you eat more chicken and more meat, this can actually increase your levels of omega-6s, which can change the ratio of omega-6 or omega-3s to omega-6s, which can cause the body to increase inflammation. And we actually dive into that further in the advanced functional medicine and nutrition program on what the correct ratios should be. So you'll get to see that in that program. Now with omega-3s, this is going to work a little bit differently than the other herbal compounds that we mentioned earlier, right? The curcumin and the zingiber or the ginger that Dr. Cohen mentioned. The nutritional compound found in fish and seafood and nuts, this is the omega-3s that we're talking about. And we want to kind of show you a specific study that used omega-3s for pain and inflammation. And this was done in the Clinical Journal of Pain in 2018. And it's called High Omega-6s are associated with inflammation, nociception, and psychological distress. What they did was they did a cross-sectional investigation of clinical and experimental pain and physiological and psychosocial functioning. And this was completed in 167 adults. The ages were between 45 and 85. They had to meet knee osteoarthritis, a screening criteria to be in this study. Blood samples were collected and they assessed the plasma of omega-6s and omega-3s of the polyunsaturated fatty acids ratios. And these were determined. And what they found was that in adults with knee pain, a high omega-6 and omega-3 ratio is associated with greater clinical pain and functional limitations. And then they also had experimental pain sensitivity and psychosocial distress compared to the low ratio group. This is why we continuously discuss increasing omega-3s versus omega-6s with the patients. And that's what we brought up in the question as well. So what we're seeing is that higher levels of omega-3s and polyunsaturated fatty acids, these are associated with a lower level of inflammation and pain in conditions such as RA, inflammatory bowel disease, dysmenorrhea, and neuropathy. And then vice versa, if you have a patient with a higher omega-6 ratio, and this is omega-6 polyunsaturated fatty acids, this was associated with more inflammation, chronic pain, and cognitive impairment and psychological distress. What's really interesting, what we're seeing here is that omega-6s right on the left-hand side here, these are going to increase your pro-inflammatory cytokines, right? The conosoids, the prostaglandins, the leukotrienes. These are like the IL-6s that we mentioned earlier. And the omega-6s are actually going to have more of a anti-inflammatory effect with decreasing the inflammatory cytokines such as the IL-6 that we mentioned. And it's important to note that omega-6s are still needed and essential in our physiology as they contribute to a number of necessary pro-inflammatory functions. And we need inflammation at times, right? It's about having the balance between inflammation and anti-inflammation. But when the issue arises is when there is too much inflammation, and that is the majority of people in the world today, is that there's a lot of inflammation that's going on. And so what we're trying to do is ensure that there is a correct ratio of omega-3s to omega-6s so it creates an anti-inflammatory cascade for your patients, thus decreasing their pain levels. Now, what dosages are effective for this? We want to go through that as well so you understand what to recommend for your patients, because often your patients will tell you they're taking a fish oil, but it's not at the correct dose. And if you look at the bottle, the majority of their fish oil is coming from omega-6s and omega-9s, and it's actually causing the opposite effect. So what you want to look for are omega-3 supplementation, right? This is going to be fish oil supplementation at about 2 to 3 grams per day. And this should be about 2,000 milligrams or 2 grams of DHA plus maybe 400 milligrams of EPA. These are all constituents of omega-3s. And this was done in a double-blind placebo study. What it showed was that this dosage for 16 weeks significantly reduced pain score and PPI in patients with osteoarthritis, and this was compared to a placebo. If you want to read a little bit more about that, it is in Rheumatology and Advanced Practice. This was published in 2020, and it's called Fish Oil Supplementation Reducing Osteoarthritis Specific Pain in Older Adults.
And as Dr. Chill mentioned, if you're looking at the natural herbal compounds or the more natural nutritional based compounds such as omega-3, remember the mechanisms are different. And it's important to look at the mechanisms because the more we understand about those mechanisms, the more we can personalize, right? A sort of a precision medicine, if we could call it that. Personalize the treatment for each patient, right? And of course, in the advanced and clinical functional medicine program, where we first start is looking at the different factors that contribute to chronic inflammation, looking at the lab testing, specialty lab testing that are not taught in primary care, and of course, looking at what are the treatment protocols to provide a more long-term relief, right? Because this is really helpful for patients. I've seen patients come back within the 2-3 months mark with now they have 50% reduction in pain or 80% reduction in pain, right? These studies show that there is a significant reduction in inflammation, right? You just got to take it over time. In most studies, it's 3 months, sometimes longer. But we also want to always develop our clinical skills to offer also a longer term solution for those patients, right? And that's exactly what we do in the clinical and advanced functional medicine program. So if you're interested in more information, if you got any questions, let us know. We got specific modules, specialty modules on chronic pain and joint degenerative conditions and neurological conditions and geriatric and cardiovascular, women's and men's health conditions. Our program really includes, you're going to learn as you go through the program all these different specialties. So that will help you as a clinician to better understand what's the root cause behind the patient's complaints, and then quickly articulate several suggestions for your patients to help them with their symptoms and their conditions. And if you're interested in learning more treatment protocols, not just for chronic pain, but for pretty much any chronic condition, from women, men's health, cardiovascular, metabolic, all of those. If you're interested in learning about treatment protocols for chronic conditions, look into our Advanced and Clinical Functional Medicine program. We have treatment protocols and specialty classes about pretty much almost any chronic condition. Many of our graduates get paid between $200 to $800 per appointment because they bring short-term and long-term solutions to their patients with less side effects, right? With a strong focus on improving the patient's well-being, right? So we're talking about vitality, right? Not just being dependent on more pharmaceutical.